Welcome to Nursing Library YouTube channel. Today we are discussing about some important points regarding digestive system along with some MCQs. Please subscribe my channel and like the video. If I reach 200 likes, I will do one more video on digestive system. Gastrointestinal tract or alimentary tract. Food goes from mouth to anus through this tract. So this gastrointestinal tract directly participate in digestion process. This GIT tract length in living persons 5 to 7 meters and non-living persons or cadaver 7 to 9 meters long. This GIT tract in ascending order is mouth, pharynx, esophagus, stomach, small intestine, large intestine and rectum. Next, accessory digestive organs. These accessory digestive organs not directly participate in digestion process, but they helps in digestion process. Accessory digestive organs are teeth, tongue, salivary glands, pancreas, liver and gallbladder. Here teeth are helps in chewing the food or grinding the food, and tongue helps in moving the food and swallowing the food. Salivary glands, pancreas, liver, gallbladder, these accessory digestive organs releases some enzymes. They are participate in digestion process. Functions of digestive system: eating, secretion, mixing and propulsion, digestion, absorption and defecation. These are functions of digestive system. Next we will see layers of gastrointestinal tract from outer to inner side. This is the first layer, adventitia or serous layer. This is a superficial layer of GIT in the abdominal pelvic cavity. This layer has again two types of layers, outer parietal layer and inner visceral layer. Between this parietal layer and visceral layer, one fluid will be present. This fluid called as peritoneal fluid. This fluid helps in protection and prevent the friction between layers. Second layer is muscle layer. This muscle layer consists of three layers of smooth muscles. The three muscle fibers are inner oblique smooth muscle fibers, middle circular muscle fibers, outer longitudinal muscle fibers. This muscle layer or muscular layer helps in stimulate the peristaltic movements. The next layer is submucosa. This submucosa layer has very good blood supply, lymphatic supply and nerve supply. The last layer is mucosa. This layer helps in protection and secretion of enzymes and absorption of food. Next we will see one MCQ. Which part of the tongue senses bitterness? A. Anterior 1/3 of the tongue, lateral aspect of the tongue, posterior 1/3 of the tongue, D. All the above. And the answer is C. Posterior 1/3 of the tongue. We will see rationale here. Sweet and salt taste buds situated mainly on tip of the tongue. Sour taste buds situated at the side and edge of the tongue. Bitter taste buds situated at the back of the tongue. The next question is, the anterior roof of the mouth is formed by soft palate, hard palate, uvula and tonsils. And the answer is hard palate. The mouth anteriorly formed by hard palate and posteriorly formed by soft palate. The term odonophagia means pain during swallowing and the term dysphagia means difficulty swallowing. The number of primary teeth or temporary teeth is 20. The sequence of upper and lower jaw is molar 4, premolar 0, canine 2, incisors 4. And the permanent teeth is 32. It is seen in adult. The sequence of upper and lower jaw is molar 6, premolar 4, canine 2, incisor 4. Enamel is the hardest part in the teeth and enamel composed 95% of calcium. In teeth, pulp cavity has blood supply and nerve supply. Salivary glands. There are three pairs of salivary glands is there. They are parotid glands, submandibular gland, sublingual glands. Parotid glands are the largest salivary glands. Weight is 22 to 30 grams. It secretes 25% secretion of saliva. Parotid duct or Stenson's duct open at upper second molar teeth. Tilin that enzyme secreted by only parotid gland. Inflammation and enlargement of parotid gland by paramyxovirus is called mumps. Next, submandibular glands. It secretes 70% of secretion of saliva and situated at base of the tongue. It weighs about 8 to 10 grams. And next sublingual glands, it secretes 5% secretion of saliva and situated at mucosa floor of the mouth. Saliva secretes 1500 ml per day. Xerostomia means decreased production of saliva or lack of saliva. Secretion increased by parasympathetic nervous system. Next we will see esophagus. Esophagus is 25 centimeters long and it started at second thoracic vertebrae. Hiatal hernia, esophagus protrude above diaphragm from normal position. This picture shows clearly esophagus move upwards from diaphragm. Pyrosis. The term pyrosis means heartburn. Pyrosis occurs when lower esophagus sphincter relaxes. Pyrosis mostly seen in gastroesophagus reflux disease. Here we can observe clearly when lower esophagus sphincter relaxes and hydrochloric acid move upside, then the person got heartburn. This is called pyrosis. We can see one MCQ here. The peristaltic movement takes place in the esophageal region is a voluntary action, involuntary action, dependence, none of the above. And the answer is involuntary action. Peristaltic movements is a involuntary action. Capacity of stomach in newborn: 20 ml, 30 ml, 50 ml, 100 ml. The answer is 30 ml. 30 ml stomach capacity in newborn. In adult, stomach capacity is 1.5 liters. In stomach, three types of glands is there. They are chief cells, parietal cells and mucous neck cells. Chief cell secretes pepsinogen and it digests proteins into peptones. Parietal cells, it secretes intrinsic factors and hydrochloric acid. And last, mucous neck cells, it secretes mucus from the wall of the hydrochloric acids and pepsinogen. The pH of gastric juice is 1.5 to 3.5. The digestion process occurs in three phases. The three phases are cephalic phase, gastric phase and intestinal phase. Cephalic phase occurs when 30% acid produced by vagus nerve stimulation when thinking about food, smell or taste of the food. Second phase is gastric phase. Most of digestion occur in this phase. When food reaches the stomach, G cells in stomach secrete a hormone called gastrin and somatostatin inhibit the gastrin. The next, intestinal phase. In intestinal phase, small intestine secretes two hormones. They are secretin and cholecystokinin. These two hormones slow down secretion of gastric juice, gastric motility and stimulate flow of pancreatic juice and bile. Next we will see one MCQ. The basic general layout of the gastrointestinal tract from inside to outside following this sequence. And the answer is B. Mucus layer, submucosa, muscular layer and serosa or adventitia layer. Next we will see one MCQ. The chief cells of the gastric gland secretes pepsinogen, trypsinogen, intrinsic factors and hydrochloric acid. And the answer is A. Pepsinogen. Next question. Hydrochloric acid that enhances the digestion process in stomach is secreted by A. chief cells, B. parietal cells, C. globin cells, D. chyme cells. And the answer is B. parietal cells. While palpating a male client's right upper quadrant, the nurse can palpate A. spleen, B. liver, C. kidney, D. appendix. And the answer is B. liver. Next question. Which is the best test for detecting liver dysfunction? A. serum albumin, B. serum bilirubin, C. SGPT, D. prothrombin time. And the answer is SGPT. Here SGPT means serum glutamic pyruvic transaminase. Next, small intestine. The average length of small intestine is 3 to 5 meters and diameter is 2.5 centimeters. Small intestine has three parts. They are first duodenum, second part jejunum and third part ileum. Duodenum, first part of small intestine, it is the shortest region of small intestine. And second part is jejunum, it is the widest part of small intestine. Ileum is the third part of small intestine. Peyer's patches found in ileum part of the small intestine. It is useful to kill the bacteria in small intestine. Intestinal gland secretes intestinal juice. It is alkaline secretion that contains peptidase enzyme for the digestion of disaccharides. The secretion of small intestinal juice is 1 to 2 liters per day and pH of intestinal juice is 7.8 to 8.3. Next we will see large intestine. Large intestine extends from the ileum to anus. It is about 1.5 meter long and 6.5 centimeter diameter. Large intestine has 4 regions. They are cecum, ascending colon, transverse colon and descending colon. The shortest part of colon: A. Ascending colon, B. Transverse colon, C. Descending colon, D. Sigmoid colon. And the answer is ascending colon. And next question: Brunner glands found in A. Jejunum, duodenum, ileum, D. All of the above. And the answer is B. Duodenum. Peyer's patches are present in A. Jejunum, B. Ileum, C. Colon, D. Duodenum. And the answer is B. Ileum. The next question is: iron is absorbed almost entirely in A. Stomach, B. Duodenum, C. Jejunum, D. Ileum. And the answer is B. Duodenum. Which among the following is a part of small intestine? A. Cardia, B. Duodenum, C. Transverse colon, D. Sigmoid colon. And the answer is B. Duodenum. Next we will see pancreas. Pancreas is a both exocrine and endocrine gland. In pancreas, acinar cells to secrete pancreatic juice. Pancreatic enzyme in pancreatic juice, it will digest the protein, fat and carbohydrates. Pancreatic juice volume is 1200 to 1500 ml per day. Pancreatic juice pH is 8 to 8.9. Okay. Next we will see one MCQ. Bluish discoloration of ecchymosis around the umbilicus is known as A. Homan sign, B. Kerning sign, C. Cullen sign, D. Osiander sign. And the answer is C. Cullen sign. Cullen sign and Grey Turner sign seen in pancreatitis. Next, most common cause of viral pancreatitis. A. Coxsackie virus, B. Mumps, C. CMV virus, D. HIV virus. Post your answer in comment box. Next we will meet next session. Please like the video, share the video and subscribe my channel. Thank you.